I will start off with an update of the numbers and doing it a little bit different this time in that I'll give the numbers, the update from our dashboard from yesterday, but also give a comparison of where we were at this time last year. So we are at 166,657 cases, and we are averaging about 200 cases per day. Our case rate is 12.9. In comparison, in 2020, this time last year, we were averaging a case rate of 60 per 100,000 and 900 plus cases per day. With the deaths, we are at 2,493 cases reported, and we're averaging about 3 cases or 3 deaths being confirmed each day. With the hospitalizations, the last report we have is 137 in the hospital and 43 in the intensive care unit. This time last year, we were at 470 cases in the hospital and 102 in the intensive care unit. And with the lab testing, we now are at 3.4% positivity. And this time last year, we were at 11% positivity. And I think the importance of looking at the difference from this year to last year is that we started vaccinating at the end of December, and that has made a huge difference. With the winter wave of last year, we had a lot of outbreaks in the long-term care facilities, and this time around, because they have such high vaccination rates, we do not have large outbreaks in those facilities. We have administered over 2 million doses, and our vaccination rate is 60.7% fully vaccinated and 66.4% with at least 1 dose. So just wanted to thank everyone who has worked so hard with the testing and with the vaccination efforts, both within the county as well as our partners in healthcare and others who have been working, and volunteers that have been working to get the vaccine out. So with that, I will turn it over to Rachel to say a little bit more about the vaccine.
Thank you. Yes, as Dr. Kassiria said, this is an important week as we're kind of remembering that this is the 1-year anniversary of the COVID-19 vaccine rollout, when vaccines, very precious and scarce at the time, came into our community, and we got them out onto providers' shelves and started getting shots in arms. And I think as we reflect on this year, we know that a lot of lives have been saved because of vaccines. Just a truly remarkable effort, not only globally, but locally, here in Sacramento. But again, too many people still remain unvaccinated, and we know too many people are still becoming seriously ill or dying from COVID-19. And so a year later, just a reminder, we have overwhelming evidence that COVID-19 vaccines are safe and effective. Billions of doses have been given. And a year ago, vaccines were scarce, but that's not the case today. We have an ample, abundant supply of vaccine and multiple vaccines that you can choose from. So just encouraging everyone again, if you're not vaccinated, to please consider getting vaccinated. It's not too late, and we would just recommend that you not put it off. And especially in light of the Omicron variant, want to emphasize again that importance of being vaccinated. The early data on boosters is very reassuring that it significantly improves immunity and is likely to protect against Omicron, especially serious illness. And so again, with this holiday season, just saying, if you're not vaccinated, please consider getting vaccinated. If you are fully vaccinated, please check and see if you're due for a booster. And if you're due, please get boosted. And we do, I want to remind you too, that last week, 16 to 17-year-old adolescents became eligible for boosters as well. So if it's been 6 months since their second dose, they can get boosted. Please visit our website to see the pop-up clinics that we are holding and continue to hold all over the county. We are still having clinics next week, the 2 holiday weeks next week and the following week. And we offer all of the COVID vaccinations for people 5 years and over, as well as boosters for all of the eligible populations. So please get vaccinated and stay safe this holiday season.
Nick, you're up.
Morning, everyone. Nick Maury. As I think everybody is likely aware by now, earlier this week, the state of California announced the rollout of a statewide indoor masking mandate effective from December 15th through January 15th. This primarily impacts counties that did not have pre-existing mask mandates. So as I'm sure you're aware, in Sacramento County, we already had an indoor masking mandate. So the effect locally is minimal. Nothing really changes here. But for those counties, including some in the Sacramento area that did not have existing mandates, this does indicate a change for those. For the counties that did have existing mandates, like Sacramento County, those remain in place. And so that can include specific exemptions that may have been in place. And so in Sacramento County, we had two in place, one for performing arts. For the performers specifically, this excludes K-12 schools, but for performing arts performers allowed to unmask on stage with either proof of vaccination or test prior to the performance, and really encouraging them to maximize distance from their audience. The other exemption we had in place was for indoor youth athletics, specifically basketball and volleyball, where athletes during practice or competition had two options, either to remain masked through the entirety, or if they did not want to do that, to undergo weekly testing for COVID-19.
That concludes the staff update for today. I will open it up now to questions from the media.
Hi, this is Vicente Vera with ABC 10. Can you hear me?
I can.
Yeah, just a clarification. You said that the exemptions for those two exemptions, they're still in place for the indoor sports and the theater performances?
Yes, correct. So no changes
Okay.
here in Sacramento County.
Thank you.
Susan with Telemundo. Susanna, sorry.
Hi, good morning. I know that the mask mandate has already been here in Sacramento County, but is there any protocol for enforcement, or is it just, kind of everybody on your honor type of situation?
Well, for the enforcement, to a large extent, we are dependent on the businesses. And then in some situation, in some workplaces, Cal OSHA can also help with enforcement.
Mike, go ahead.
Hi, this is Mike from the SACB. I just want to confirm that we still haven't seen or detected any Omicron cases locally in Sacramento County yet. And just given that, is there any expectation of when it might become dominant, given what's kind of happening at the national level and across California?
Jamie, did you want to take that one?
Sure. So no, we still do not have any confirmed Omicron cases. Again, it's probably safe to say that it is present locally. We just have not yet received confirmation from the state lab who's doing a sampling of our cases for genotyping. In terms of predicting when it will take over, that's a little more difficult to say. I'd probably have to look at patterns in other locations. We do anticipate that it will become the dominant variant, but currently Delta is still the dominant variant locally.
Oh, Chris Hooks, go ahead.
I actually had the same question, but now I want to circle back real quick to what Jamie said, just to clarify something. You said that you guys are waiting from something from the state to verify that you guys are using the county's tools now that you guys have the same tools.
I can help with that. So I think a couple of weeks ago, we did state that our county lab is now doing whole genome sequencing. And Jamie was referring to genetic typing, which is a little different. It takes a shorter time to do the genetic typing, but it helps in being able to identify cases as well. This is the process that is being used predominantly in Yolo County, and it's used by the state as well. The state also does do the whole genome sequencing. So we're still waiting for confirmation because we are constantly submitting tests both to the state and also to our public health lab for to check if we do have any variants.
And I know a few weeks ago, unsure. You all mentioned that relying on the state was taking a little bit more time than it would have doing it in-house. Is there concern that it may take more time now that you guys are doing it this way than instead of in-house? I know it's two different situations, but is there any concern there? Or?
Well, the whole genome sequencing does take time, regardless of where it's done. The shortest period that it can take is 5 days, but usually it takes about 2 to 3 weeks to complete the whole process. And so that's the main reason why it's used more as a tool for surveillance as opposed to making decisions on patients that we're receiving. The genotyping, as we mentioned, takes a much shorter time, but we don't do that in Sacramento County, so we do have to depend on the state to do that for us.
Susanna, go ahead.
Yeah, another question. Nationwide, there's what they're calling a triple threat. Cases of the flu are on the rise. Obviously, you mentioned here, at least in the area, Delta is still the dominant strain or variant. Obviously, we haven't detected Omicron, but at a local level, what are we seeing in terms of flu cases? Are we also seeing a rise here, or is that pretty much at a steady level?
Jamie, do you want to take that one?
Yeah, so typically when we see flu cases, they kind of start over on the East Coast and then transition over to the West Coast. We typically see a peak in flu cases around February. So we haven't really seen a huge amount yet. I don't have the exact numbers of what's been reported to us. But again, the only cases that are reportable for influenza to the local health department are severe cases. So hospitalizations and deaths under age 65. Sometimes we ask, Dr. Caserio will ask for all ICU and hospitalizations to be reported to public health. But according to state guidelines, only younger cases and severe cases are to be reported to us. And I'm not aware of any that have been reported to us yet this season.
Thank you.
Vincente?
Yeah, I just wanted to follow up on a question that Chris had. You say that you're waiting for confirmation for samples over at the state lab. Is that just like a general statement, or are you guys waiting for specific samples?
It's a general statement.
Okay, thank you.
Mike, go ahead.
Yeah, I just wanted to ask, and this gets asked pretty much every week, but is there any, when we're monitoring for cases and Omicron and things like that, are there any thresholds or anything that the county's looking at right now in terms of in July, for instance, once Delta kind of became the dominant variant and what we knew about Delta, we returned to a mask mandate. So are there any further actions or protocols or restrictions that might kick in if Omicron is dominant, or if cases start to, reach a certain level?
We do not anticipate to take any additional actions at this time. We are still pushing for everyone to get vaccinated because we know that that is our best defense against whatever variant is circulating. And definitely now with the Delta variant, it's very important that we get everyone vaccinated. We got to 60%. Our next target is 75%. So we really need to continue working on that. And then also, of course, reminding people of the things that they can do to protect themselves and their loved ones, which is masking, especially if they are in public places or in crowded places. And for especially people with underlying conditions that put them at risk, to avoid places that could put them at risk, especially places that are crowded. And then one thing also that the state put in place that became effective yesterday was a travel advisory, where people who are coming to California, either returning or visiting, and regardless of whether it's a domestic or international flight, they are advised to get tested 3 to 5 days after arrival. And those are all things that can help to catch cases quickly and prevent the spread. And of course, good hygiene is important as well.
Susanna, go ahead.
Last question, I promise. Dr. Kassiri, you mentioned some numbers about hospitalizations and ICU beds. You mentioned also some numbers in comparison to last year, which was a big difference. But this year, is that number at this point of the year, is this number increasing, or is that also just kind of maintaining at a certain level?
So the hospitalizations have gone up and down a little bit in the last month or so, but right now it seems like they're remaining steady. So as I mentioned, 137 cases and 43 in the intensive care unit.
Thank you.
Any other questions from media? Just a reminder, this is the, Chris, go ahead.
Yeah, sorry. Just I'm curious if it's, I understand they're comparing the two from sort of the 1 year mark of getting the vaccine, but would it be more appropriate to compare now to a more recent surge post getting vaccines? Just as like a comparing if this surge, sort of this increase, holiday increase of cases is close in comparison for people to understand where we're at, knowing that, vaccines are widely available, instead of looking at when they weren't widely available.
Well, usually when we're doing comparisons, we compare with the same period from the previous year. So that's one of the reasons why we were comparing where we were at this time last year. And I did mention that I think the biggest difference is the fact that this time around we do have vaccine. So I think it just emphasizes the importance of vaccination at this point.
And you can see on our EPI dashboard, a comparison of other waves if you're interested too. I mean, this wave is also slightly lower than the one we saw in August with Delta. But we do also have a larger percent of the population vaccinated today than we did in August.
Thank you.
Okay, I'm going to do a last call for questions. Do we have any additional questions from media?
I have a question, KCRA.
Go for it.
Okay, so we saw San Francisco get the exemption, some other places in the Bay Area. Like, what would it take for Sac County to ever get an exemption? Is that ever in the realm of possibility?
So for clarification, as Nick mentioned, for counties that already had a mask mandate in place, they were allowed to keep their mandate. And for many of the counties, those mandates included exemptions. So with Sacramento County, Nick mentioned the exemptions that we had. And for San Francisco, because they had a mask mandate as well, they were able to keep their exemptions. So it's not that San Francisco was exempt from a mask mandate. It's just that they were able to keep the exemptions that they had already. They still have a masking mandate, indoor mandate as well.
Any other questions?
Sorry, one more. What response do you have when the sheriff comes out and says he's not going to enforce the mask mandate? Does that undermine the message, basically?
Well, it's unfortunate that we haven't been able to get on the same page as far as that goes, but we work very closely with the sheriff's deputies and a lot of other things. So we still know that we do have their support. And so in this instance with enforcing the masking mandate, that's why a lot of the enforcement has fallen on the businesses. And then also, as I mentioned, Carl OSHA is able to do enforcement as well. And public health and environmental management and code enforcement, what we've been doing when we get complaints from the public about businesses that are not following the mandate is we do education. And oftentimes that has been successful.
That concludes the media briefing for today. As a reminder, this will be the last one for this year. We will reevaluate after the first of the year whether these will need to continue. We're going to move on to the Spanish portion of the briefing. Anyone is able to stay on if you would like. If you don't, you can drop off. But we do ask that the Spanish stations do remain on the line. Thank you all. Okay, Susanna, I see you're still on. Who do we have on from Univision?
I believe they're just recording. They don't have anybody specifically.
Oh, okay. Susanna, do you mind if you ask the question in English first and then ask it in Spanish, just so Jana and I kind of have a general idea of what you and Victor are talking about?
Yes. Yeah, no worries.
Otherwise,
Okay.
we're just here in the dark.
Sorry about that. Buenos días, Victor.
Buenos
So the first question, obviously, that I had asked, first question in English is, you know, when it comes to the mask mandate, how does the county plan to enforce it? So in Spanish would be, con este nuevo mandato, cómo el condado planea llevar a cabo que, bueno, todas las personas sigan este nuevo mandato, va a haber algún tipo de, como dicen, como code enforcement o cómo es que se va a llevar a cabo esto.
Claro, más que nada lo que la doctora ya mencionó es más que nada educar a dueños de negocios, organizaciones y la comunidad en general de la importancia del cubrebocas y cómo ayuda a prevenir el contagio del virus. Entonces, el trabajo del condado va a ser más que nada enfocado en la educación.
The other question that I had, I don't know if you can do it in Spanish, but nationwide, there is this trend that they're seeing that the flu cases are on the rise, and obviously the two variants right now, obviously Omicron, which hasn't been detected here, but you know, Delta has, and it's, you know, on the rise. So I mean, are we seeing flu cases kind of increase here in the county? Ahora en español, a nivel nacional, se está viendo que hay una tendencia donde los casos de la influenza, Omicron y Delta están incrementando. Entonces, aquí a nivel local, obviamente no se ha detectado Omicron, pero Delta sigue está existente aquí, y la influenza también. Entonces, ¿están viendo casos de la influenza incrementar también?
No hay reportes de casos o números que van incrementando. Se mantiene cerca la información que va llegando y los exámenes que están haciendo, pero más que nada el esfuerzo es en invitar a la comunidad a que vaya a las clínicas y reciba las vacunas, ya sea de la influenza o de la prevención al COVID, que vienen siendo las tres vacunas que tenemos disponibles, Pfizer, Moderna, o la que esté disponible en cada centro. se les invita a la gente a que vaya y la reciba.
Dr. Casirius, the doctor, she had mentioned that, some numbers on hospitalizations, ICUs, things like that. I mean, in comparison to last year, they're pretty down, but, this year, have they been, increasing like expected? So en español, obviamente, la doctora que sí había mencionado algunos números en cuanto a hospitalizaciones y camas en cuidado intensivo. Obviamente el año pasado estaban un poquito más ocupados, más saturados los hospitales. En este tiempo, ¿cómo se está viendo la situación de hospitalizaciones y camas en cuidado intensivo?
Todo continúa, se podría decir, normal para la temporada, que en estas fechas regularmente incrementan ciertos números, pero no a un nivel excesivo. Se mantiene monitoreando el número de personas que se atienden en los hospitales y la atención que están recibiendo, pero no estamos en un nivel de emergencia que pueda preocupar a la comunidad.
Y lastly, it has to do with Omicron. How's the tracking going on? I know that there hasn't been any cases detected, but how is that investigation with the genome sequencing stuff? So, en español, ¿cómo va la situación en cuanto a la investigación y monitoreo de Omicron en el condado?
Por el momento se mantiene estable, no hay casos, no se reporta algo que pueda impactar a la comunidad, pero en cuanto a la detección, la examinación, el estudio del virus en sí, los especialistas, ya sea con el condado o el estado, son los encargados de eso, y la verdad no podría yo explicarte tanto cómo es el proceso.
Okay, I think I'm done. I think we got it. All right, Sam, I think we're good.
You're all good?
Yes.
Not all Omicron part. I'm just not a scientist, so I mean, I'm not gonna go in there and stick my feet in, but
no, it's all good. It's all good. No, gracias, Victor, as always, with your help.
No, por nada.
Okay, then we will wrap this up, and I will send this out to you as soon as I get the recording from Zoom.
Sounds good.
All right, thanks all.
Thank you.
Bye.